breathing. Do you feel any nasal obstruction? No. Okay. And then palpate for paranasal cyanosis. The frontal cyanosis just under the burning eyebrow. Pen? Do you feel pen? No. The maxillary cyanosis. Then the lip. Observe the lip color and the moisture, and note if there are any lumps, ulcers, or cracking. And ask the patient to open his mouth and look into his mouth and inspect the oral mucosa. You should use a comb. Press the thumb blade down upon the middle point of the tongue, and far enough back to get a good visualization, but not too far. If you put it too far into the mouth, it will cause the gagging. The patient will vomit. Open your mouth. Okay. You should inspect the pharynx, the anterior and posterior pillar, the uvula, and the tonsure. The tonsure. When the patient say "ah," the uvula will move up. Yes. Tonsils don't move. Normally, in adults, you shouldn't see the tonsils. If you see the tonsils, it is enlarged and abnormal. Inspect the neck and notice symmetry and is there any marks or scars. Look for is there enlargement of the parotid or submandible gland, and is there any visible lymph node, and ask the patient to move his head, and is there any pain when he flex, extend, or bend lateral or rotate his head? Is it okay?
इसका ग्लास कौन है ये फेंको निकाल के
How take the lymph node? I have told you that normally you cannot feel the lymph node, and when you feel the enlarged lymph node, you should notice its location, size, shape, and tenderness, and is it fixed to the underlying tissue. Yes, you should examine the lymph node in sequence. Normally, first the feet bend forward. Okay, yes. The submental lymph that's just under the chin, and to the each side, and then the submandible lymph node. Just move the skin over the underlying tissue. And then the jugular vein. The jugular vein is located along the anterior border of sternomastoid muscle. The jugular. And then the supraclavicular. It's up to the supraclavicular, and then the sternomastoid muscle.
Sternomastoid.
Post. And the pre-auricle and post-auricle, sub-occipital and pre-trapezius. The upper border of the trapezius. Then inspect the patient's trachea. Is there any deviation from the middle line?
There is some deviation.
Yes, and you can feel the trachea, and put your finger along the trachea and feel the space between trachea and the sternum-mastoid muscle, and compare with the other side. And is there
symmetry?
Yeah. And inspect the thyroid gland. When back and in some people you can see the thyroid cartilage and cricoid under the thyroid.
This one?
Yes. Thyroid cartilage, and under them the cricoid cartilage, and then under the cricoid cartilage there is thyroid gland. And when you ask patient to drink water and to sip water, and then you can see the movement of these three structures. Yes. And then use your hand and palpate the thyroid gland. You can do this palpation in front of or behind the patient. I will do this behind you.
Online study.
Okay, let's go.
Ask him to bend his head
Bend
forward,
your head forward.
to relax his sternum-mastoid muscle, and put your hand on his neck. Just make your index finger
Like you're
under
going to kill him.
the cricoid cartilage, and palpate the isthmus of thyroid. You see that the thyroid is made up of the isthmus and the two nerves, right nerve and left nerve. First the isthmus. Please swallow. And then just push the trachea with your left hand towards right, and palpate the space between the displaced trachea and the sternum-mastoid muscle. This space, palpate it, and ask him to swallow.
And what do you observe, ma'am?
Use this method, you can check the other side.
क्या observe करते हैं मैंने?
If you feel the thyroid gland is enlarged, maybe you should use your stethoscope. Put your stethoscope on the thyroid gland and pay attention to, is there any murmur? Is there any vascular murmur?
If you have a soft copy, that would be better.
The last thing I should say is you can feel the carotid arteries on the neck. It's just near the thyroid cartilage.
खत्म हो गया बोले कौन खाया
thyroid 已经讲过了，现在讲 carotid。
Okay.
Can you feel your
Carotid.
pulsation of your carotid artery?
Oh, yes.
Yes.
I have one.
Notice that do not place both at the same time. Don't at the same time.
You'll die.
That will lower your blood pressure, and you will
Faint.
You will, no.
Yeah, faint.
You won't die.
Faint or faint.
now
Band
I
kar.